Hello, my name is Paula Stover, and I'm a registered nurse with experience in the mental health field. We often get asked what we do when a person is hallucinating. In this next skit, Christian, a volunteer from the class, is trying to follow Mel's simple instructions, but as you will see, he was challenged with hearing too many voices and seeing too many other people besides Mel. Let's watch. Randall is another HST on the mental health team.
Take 2 steps
Hey man,
forward.
I need you to step over there by the
What are you
washing
doing
machine.
with those green scrubs?
Hey man, put your hand up. Both hands. Yeah. Raise your left hand out. Stand on one foot. Hey man. Hey, those books are fantastic. Take 2 steps to your right. Look to your left. That's your left. That's your left. Turn the camera.
Take your pants off. Zip up your coat.
4 steps forward.
Yeah, you need a haircut.
Okay, guys, that's you'll notice some things about his face.
Look at his body language. I don't know about it.
What did somebody see him do?
Pretty challenging, don't you think? What did you notice Christian doing? What were his behaviors? He smiled shyly, he looked confused and was a bit wobbly on his feet, and he took a long time to respond to each of Mel's requests. Have you ever seen a person on the street behaving in a similar manner or talking with him or herself? This person was probably hallucinating, hearing, seeing, or feeling something that is very real to him or her. So what do we do when a person is actively hallucinating? First, we never argue with the person. We keep the environment quiet and calm, and we watch them closely while giving them the freedom to move about the facility. We have various levels of observation that are ordered by the doctor, from 1-to-1, which is close observation, to every 15-minute checks on where they are. We also help their peers understand that for the time being, they are simply preoccupied and to let them have some space. To help us stay focused, we remember a few things. These sensations are very real to the person having them. Most hallucinations can be stopped or minimized with medication, and some people live with their hallucinations quite well. We work with the person to normalize their behaviors by orienting them to the day and the time and talking in a normal manner. We stay calmly present and aware. We speak quietly and slowly and very politely. We give the person extra time to respond to our requests, and we realize the person is under stress while trying to blend a very busy inner and outer world. Our goal in working with people in crisis is to help them gain self-control so they can live comfortably and safely in society. Let's watch another skit from the high school classroom. Here, one lady has issues with people touching her and her belongings, and another lady has borrowed her gloves.
Hey, she's got my gloves. She's got my gloves. Those are mine. No, those are mine. Those are my gloves. She got them out of my room. They're mine. They're mine. I brought those in. You saw that they're on my list of what I brought in, right? Well, is he going to get them back for me? I need those back. I need those back.
Well, Mel,
Oh, Randall.
We'll just head over here.
Okay. Well, I trust you. You
I know.
helped me before.
And Mel's good.
She's a thief, though.
Remember?
She's taking things.
Well, Mel took care of you
Why
yesterday
was she
too.
in my room?
Well, it's because all the girls have one room. Her
Well,
room
that's
is your room, technically.
Well, then I want a locked bin.
Well, I'll see what we can do about that.
Those need to go in the safe. Those are very
If you want to
special
lock them
gloves.
up in the tech
Yeah.
office, we can do that.
Okay.
That's not a problem.
That'd be good. As soon as he better get them back.
Mel's working on it.
All right.
Mel's stuff. He's taking care of it right now.
Okay.
So we're good. Just calm
All
down.
right.
She ain't going nowhere with those
Take
gloves,
my
Miss
things.
Paula.
Tell you what, I need to be leaving this place.
Well, we work on that every day, a little bit by a little bit.
Yeah. They say I might go home tomorrow. I'm going to need those gloves when I go home.
We'll have them. When Mel brings them, we can lock them up in the tech office, and there won't be no more
Here
problem.
they come.
All right. Well, calm down.
Should I?
No.
Okay, you taught me.
Deep breathe. Deep
That's
breathe.
right, you've taught me.
You're good.
I don't have to be afraid.
This is the
I don't
truth.
want her near me, though.
Okay, well, she's right here. She's got to give you the gloves, though.
Well,
Oh.
You're going to have to get close enough for her to give you the
Oh,
gloves.
okay.
I was just coming because I really like these gloves and you have a whole lot. And the HST told me that I should give them that to you.
Yes, you should. They're mine. But do you need gloves? I have a whole bag of gloves.
And that's,
Those you cannot have.
but can I have a pair?
Yes. I would be willing, yes, she can have one pair.
Okay.
All right.
You're not still angry.
Well,
Miss Paul, she's just telling you those
you can
stuff
play
now.
cards with us. If you hand me those gloves back, yeah, you can play cards with us.
Oh, thank you.
Don't come close. I don't want her touching me.
Okay, here, pass them to me.
And those need to go to the laundry.
Yeah, 'cause I'm
Okay.
gonna take care of these anyway.
And then they're gonna be,
Thank you
yeah.
so
I don't
much.
let anybody touch me. Nobody touches me.
Okay.
I'm special.
Use your gloves back.
Well,
We're
those need to
lock
go to
them
the
up,
laundry. And
Okay.
you lock them up. Yeah.
gonna lock 'em
Okay.
up.
It might look pretty silly for adults to be arguing over gloves, but people with mental illness crises are very stressed and they can revert back to basic survival instincts. As they feel better and gain a healthy perspective again, they act more in line with social norms. Let's look at one more skit and hear some discussion that took place in the class.
You see how we are with anger? I mean, can you picture this in your family, with your friends and stuff? And how this could help you in healthcare? Your healthcare careers, you got it?
Well, it shows you what you'll see when we operate. You never react to them, to an angry person with anger yourself. You know, it's real easy to have a bad day and come in and be like, "I can't deal with you yelling, Paula." You know, that's That's already going to take things on the wrong course. Mel stays calm, I stay calm, and we control the situation with just our voices, you know. The louder
you
Paula
just brought up
gets.
something really well too. Sometimes we have bad days. Can you be 100% all the time, every single time that you come to work? No, nobody's that perfect.
I got a 9-month-old baby, I don't sleep,
Yeah.
you know.
There was a
I'm
period
angry
of time
right
this
now.
summer when we took care of our teammate, you know, and so we took care of a few things for him, and he took care of a few other things for us because he was getting 2 hours of sleep a night. And so we will do that for each other.
Right.
But you want to come to work with a lot of good self-care where you can be as strong as you possibly can. All your patients in your whole career, they're vulnerable. That's why they're in your care. And so you want to be the best that you possibly can be. Shall we do the angry telephone one real quick? We can do a quick one on that.
Yeah, we can do the angry telephone.
And this is, think about your family again. Think about your family, and we'll do it real quick.
Okay.
I'm using the telephone, and who's wanting to come use it?
I'm coming to use the phone.
Oh, okay. All right.
I need to make a phone call. My dad's on a fishing trip and he's got my special rod. Mel, I need to use the phone, dude, for real.
Rod.
Like, it's past the point. We need this phone now.
What?
Okay, give me 2 minutes.
I don't
Listen, I'm
have 2
on
minutes.
phone.
My grandpa's gonna be out there and he's gonna throw my reel in the water because the old man, he's got gnarly hands, ain't gonna get it done.
Give me 1 minute. I'm gonna go.
I don't have 1 minute.
You can work on
Okay,
it now.
you better go hang that
15
phone
minute
up.
rule.
Hang up that
Yeah,
phone or
right.
I'm about to lose it. I'm about to get real.
I have
I'm about to throw
none.
something.
Oh, well.
I hit
I've
that
been
old
on
man in
it.
the face with a rock. I will. I will do it.
Now, what if that was
I ain't
your mom?
scared. I hit my mom with a rock. I ain't scared. I ain't scared.
Give me 1 minute. I'm gonna talk to
Oh,
Wait,
all
you
right.
better go
Hey,
get off
you
the
want
phone.
me to get off
I'm
the
telling
phone?
you, 'cause I can't
I'll call
handle
you
it.
later. Okay.
Lady been on the phone for 15 minutes. It'll be all
Oh,
right.
for heaven's sakes.
See, she's off.
You guys need more phones in this place.
All right.
Feel
better. I feel better now.
That's a good suggestion, and I'm gonna suggest to the staff that
Come on,
we
let's
put
get on the
more
phone.
up. But based on our policy, all clients are allowed 15 minutes to 30 minutes.
That's just
And
not
you've
much.
been on now 45 minutes.
You said 30 minutes.
I said we are allowed 15 to 30 minutes, but you've been on there 45.
Well.
Now,
So that's
2
considered.
things happen, and I know there's a lot going on there. 2 things happen. Mel doesn't react to me with my ridiculous statements about an old lady in the hell with a rock. First of all, because Mel knows I ain't got a rock. Second of all, that never's going to help you. Whenever you're reacting to the statements like that, until it becomes an actual physical thing, it's a lot of wind, you know. And Mel didn't react to any of that, and he stayed focused on me, you know, what I was doing. That's how you know what somebody's doing. I can tell you all day I'm gonna hit somebody in the head with a rock, but unless I go get a rock, I'm not gonna do it. I don't have a rock to do it with. And the same thing with Paula, you know, you see Linda talks to her and she rationalizes with it. her voice stays calm, you know. The more upset Paula gets, the more calm Linda gets, and it draws them in.
As you see, people in mental health careers need to have a great deal of self-control. We are sometimes referred to as therapeutic agents because we can often help a person move quickly out of anger into a more rational way of solving a problem. Most of the people we work with come to us right away if they are feeling upset for any reason, and we work with them until they feel better again. As a nurse, I often get asked, how do you stay calm every day? Well, I have had specialized training that keeps my mind rational and alert to what is needed in the moment for that particular person. And I rely on my teammates to help me out, as I do for them every day. One of my favorite techniques is to look at my own inner dialogue. You know that little voice in your head that talks about right and wrong and reminds you to do simple chores? Well, that's our inner dialogue. It's a helpful mental tool, and athletes use it to get ready for a match or rehearse their plays. But this little voice can sometimes broil us up into a rage if we let it get out of hand. So a different way of thinking about something can calm us right down. In mental health, we talk to ourselves when we get ready to work with an angry person. We take a deep breath and we center, and we say to ourselves, I can do this right now. And we face the person directly with an open posture, and then we think, I'm available to you, and I'm not afraid, and I will not be hurt by your words, and I am paying attention to you. And when the person is calm, we congratulate them for calming themselves and ask that they let us know right away if they feel upset again, and they do. We are taught these skills in nursing and in medical and in social work school, and then we get extra practice and training on the job. We've found that almost anyone can learn to communicate with respect. And we teach these skills every day to all our consumers as part of their treatment. And we role model these behaviors. To help a person during anger, we are very centered in compassion. We are a very good listener for just a few moments. We're focused on the present moment and the person and not on the story. And then we remember that anger is self-limiting, so we stay respectful as he or she calms him or herself down. You can find us working with people on these skills at just about any time of the day on a crisis stabilization unit. As in anything in life, practice makes skills better, and we get very good at these skills. We also are asked 3 common questions. What do I do if I can't stay calm? Well, we always say to each other, be safe, be sane, choose serenity, and walk away. There's always another teammate who will work with the person. So the second question we often hear is, what qualities do I need to hone? Well, self-control is very important. Compassion is another one. And then our most important skill is respectful listening. Really hearing that person as they're telling us what they're concerned about. So what was your most memorable patient? Mine was Miss P. She's a woman with schizophrenia, and we spent many nights pacing and talking, and she had very normal thoughts and worries and concerns, just like anybody else. She was a very smart person, and she took pretty good care of herself. But she liked to talk out loud to the voices in her head. And one night, the neighbors were worried and called the police, who brought her in. The doctor tried several different medications to help control the voices, but she had trouble with the side effects, as some people do. She really didn't mind her voices. They keep me company, she would say. And she was able to take care of herself. So she and her healthcare team decided if she would not talk with her voices when the neighbors could hear her, she could go home. And she did. You can go to any of these links for more information. And you also might find these books helpful. Whatever you do in life, we hope that through watching this video, you now have a better understanding of persons with mental illness and will consider looking into a mental health career. Thank you for watching.